All right, let's get right into it. If you're a nurse, you already know the single biggest thing draining your time and your energy. It isn't the patients, it's the paperwork. Today, we're going to talk about how to fix that for good.
This isn't just some catchy line, it's the absolute reality for so many of us. It gets right to that feeling of being totally swamped by administrative tasks, long after you were supposed to be home.
Does that sound familiar? I bet it does. Your coworkers are gone, the unit's finally quiet, but there you are, still clicking, still typing, trying to remember and accurately document the incredible care you gave hours ago. And you can feel that pull, right, between doing your job right and just getting back to your own life?
And look, this isn't just a feeling you have. This is a real, measurable crisis. So let's break down what this documentation trap actually looks like.
Here is. This is the number that defines the whole problem. Study after study shows that nurses spend up to 35% of their entire shift just on documentation. Not with patients, not doing assessments, not teaching, just documenting. Just stop and think about what that really means for a second. On a standard 12-hour shift, that's 4.2 hours gone. More than a 30-year day isn't at the bedside. It's staring at a computer screen, trying to piece together details from hours ago.
And that, right there, that's the real cost. It's not just about having a long day. It's about that slow, creeping burnout. It's time that should belong to your patients, or to your family, or just to yourself, being eaten up by a keyboard.
So, what's the way out? Most people think it has to be some kind of complicated, super technical skill you have to learn. But here's the big secret. It's not. It's actually a skill you already use every single day.
This is the absolute key. Talking to an AI isn't about learning to code. It's about giving clear, well-structured instructions. It's the exact same skill you use when you give a handoff report or when you explain a new diagnosis to a family member. You are already an expert at this.
So if you've already got the skill, how do you actually apply it? Well, let's look at the night and day difference between just a simple request and a truly professional nursing-focused prompt.
Okay, look at this. On the left, you've got this vague prompt, write a nursing note. That's going to get you useless, generic junk. But on the right, that's a professional prompt. See the difference? It's all about structure. You give it clear context about the patient. You define your role as an RN. You specify the action you want, a SOAP note, and you tell it the format for an EHR. This is how you get a professional result. And here's the thing you really have to get. The power isn't in the AI itself, it's in your instruction. When you learn how to communicate your clinical expertise this clearly, you literally transform a 25-minute charting slog into a 45-second review and sign off. All right, let's make this super practical. I'm about to give you a tool you can use on your very next shift to save yourself 20 minutes, right away. Here it is, a totally ready-to-use template for creating patient education materials. Now notice the structure. Every single one of these 7 sections forces the AI to be specific, to be comprehensive. It makes sure you cover everything from a plain language diagnosis to the exact warning signs. You get a clinically sound document every single time. And here's what that looks like in the real world. You just fill in the blanks with your patient's specific details. In this case, a 72-year-old with heart failure. You specify the reading level, the exact warning signs, the medications. You are still the clinical expert. The AI is just your incredibly fast assistant. And what's the result? A professional, comprehensive, easy-to-read handout, perfectly tailored to your patient. And you created it in about 90 seconds. I mean, just think about how long that would take to type out from scratch. This is your first real taste of getting your time back. Look, this isn't just about saving a few minutes here and there. This is about a fundamental shift in the skills you need to be a successful and a sane nurse for the next couple of decades. Let's put this into perspective for a second. Back in the 70s, learning to drive became a non-negotiable life skill. In the 2000s, if you worked in a hospital, you had to master the electronic health record. Well, learning to prompt an AI in 2025, it's exactly the same kind of critical skill shift. It's not optional anymore. And this is why it matters so much. Mastering this isn't about being techie. It's about professional survival. It's about thriving. It's about freeing yourself up from all that administrative nonsense so you can focus on the things only you can do, providing that expert hands-on patient care. Because the alternative, it's just more of the same. The nurses who don't adapt are going to be the ones who keep feeling that documentation crush, who stay late every single shift, and who, eventually, burn out from a problem that is now, finally, solvable. So it really just comes down to a choice. The AI is your assistant, not your replacement. Structure is everything, and all you have to do is start with one small task. So which nurse are you going to be? The one stuck at the station at 8 p.m., or the one who learned a new way to walk out on time every single time?